Welcome to the FIND lecture series. On behalf of the Perinatology Research Branch of NICHD and the National Institutes of Health, my name is Lami Yo, and I am one of the developers of FIND. In 4 different videos of this YouTube series, we are teaching the novel technology known as Virtual Intelligent Sonographer Assistance, or VISA Assistance, which we also call VISA. This is actually one of the most important and essential tools of the FIND method. Therefore, it is definitely worthwhile taking some time to learn about this technology. VISA Assistance, or VISA, are video clips for each of the 9 cardiac views, which function as a virtual sonographer to intelligently assist you in examining the fetal heart. So be sure to take advantage of this feature when performing the FIND method. This is now part 2 of 4 videos on VISA Assistance. Here we will review the 7 benefits of VISA. VISA is used to study the fetal heart in more detail and further improve the quality of ultrasound examinations for pregnant women. Before we begin, please note that all of our scientific publications on the FIND method are freely available. You can access them by going to the main page of our YouTube channel, then click on this website link to the Perinatology Research Branch of NICHD and the National Institutes of Health. Links to all our publications on the FIND method can be found. Also, we encourage you to subscribe to our YouTube channel to learn more about FIND, its features, and practical implementation in the clinical setting. More educational presentations will be forthcoming. Now, before we discuss the 7 benefits of VISA Assistance, let's briefly review the FIND method, or 5D Heart, first. This is a novel sonographic method to examine the fetal heart. FIND automatically generates and displays 9 standard fetal cardiac views simultaneously by applying intelligent navigation technology to stick volumes of the fetal heart. FIND simplifies the fetal cardiac examination, shortens examination time, thus improving clinical efficiency and workflow, and reduces operator dependency. After a stick volume has been acquired and then determined to be appropriate using stick loop, the next step is to mark 7 anatomical structures of the fetal heart within the stick volume using the anatomic box tool. And once marking is completed, this triggers intelligent navigation technology. By identification and selection of key anatomical landmarks, the system will generate a geometrical reconstruction or model of the organ of interest, such as the fetal heart, and then automatically navigate, find, extract, and display specific planes, in this case, 9 standard fetal echocardiography views for the FIND method. We refer to the 9 fetal echocardiography views automatically generated and displayed by FIND as diagnostic planes, and they are the 4-chamber view, 5-chamber view, left ventricular outflow tract, short axis view of the great vessels, right ventricular outflow tract, 3 vessels and trachea view, abdomen, stomach, ductal arch, aortic arch, and the superior and inferior vena cava. Here are the 9 diagnostic planes in motion displayed together in a single template for a normal fetal heart. Note that FIND also provides automatic labeling of each cardiac view, left and right sides of the fetus, cranial and caudal ends, and fetal anatomy. VISA Assistance is activated for any of these 9 cardiac diagnostic planes by first clicking on the diagnostic plane and then pressing the button indicated by the red arrow. Next, the VISA Assistance video clip for the cardiac view is activated. On the left side is the original diagnostic plane of the 3 vessels and trachea view, while on the right side the VISA video clip plays and there is automatic sonographic navigation and exploration of surrounding structures. As a result, the VISA image has changed to become the 3 vessel view, which is different from the original diagnostic plane, which is the 3 vessels and trachea view. VISA Assistance stands for Virtual Intelligent Sonographer Assistance. VISA Assistance is an operator-independent tool that allows automatic sonographic navigation and exploration of surrounding structures in each of the 9 cardiac diagnostic planes. It is essentially a virtual sonographer in the form of video clips for each of the 9 cardiac views. A virtual sonographer would function similarly to an actual sonographer scanning the fetal heart in real time. Now let's review the specific benefits of VISA and when to use this tool. There are 7 benefits to review. The first benefit is that VISA Assistance improves the success of obtaining fetal cardiac views. This is the original publication on the FIND method. In this study, we determined the success rate of obtaining 9 fetal cardiac views from stick volumes of normal fetal hearts. FIND was able to generate 9 fetal cardiac views using the diagnostic planes in 78 to 100% of cases, but with VISA Assistance, this increased to 98 to 100% of cases. For example, the success rate of obtaining the left ventricular outflow tract increased from 90% to 98% through VISA. Similarly, the success rate of obtaining the short axis view of the great vessel's right ventricular outflow tract increased from 84% to 100% through VISA. This improvement is relevant because obtaining the outflow tracts are an essential requirement in performing fetal echocardiography. Here is an example. This is the left ventricular outflow tract view obtained by FIND. On the left is the original diagnostic plane, however the aorta is suboptimally seen. Through automatic navigational movements from VISA, the left ventricular outflow tract view has now been obtained successfully. This is the actual VISA video clip that is activated by the operator. On the left is the original diagnostic plane, however the aorta is suboptimally seen. Again, through automatic navigational movements, the left ventricular outflow tract view has now been obtained successfully. Note the difference between the original diagnostic plane on the left and the VISA image on the right. Here is another case. The diagnostic plane on the left appears to be the ductal arch. However, it is not the true arch, and there is actually some overlap with the aortic arch. Through VISA navigational movements, the true ductal arch is now obtained successfully in the right image. To accomplish this manually using 2-dimensional ultrasound would require operator skill along with subtle movements of the transducer, and could be a challenge. Yet VISA is able to accomplish this automatically. Here's the last example showing VISA of the aortic arch. The diagnostic plane on the left shows that the aortic arch view was suboptimally obtained. However, after VISA Assistance has been activated, automatic navigational movements now obtain the aortic arch successfully. In summary, VISA assistance improves the success of obtaining the fetal cardiac view of interest when not initially obtained via the diagnostic plane. The second benefit of VISA is that it provides more information about the diagnostic plane and its surrounding structures. Indeed, one can use VISA to visualize specific structures automatically, such as the pulmonary veins. Let's now review some examples. On the left, the three vessels and trachea view is shown and is characterized by the transverse aortic arch. The three vessel view, however, shown on the right, is characterized by the ascending aorta in cross-section. Both views should be obtained when performing fetal echocardiography. Moreover, obtaining these views should be attempted as part of the routine cardiac screening examination as stated by professional organizations. VISA scans the stick volume spontaneously in a purposeful and targeted manner to visualize specific structures. From the three vessels and trachea view diagnostic plane obtained by FINE, VISA can automatically depict the three vessel view. Here on the left is the original three vessels and trachea view diagnostic plane. The transverse aortic arch is clearly seen. After VISA has been activated, automatic navigational movements are performed, which will change the three vessels and trachea view to the three vessel view, which is identified by the ascending aorta in cross-section. Here is the VISA assistance video clip. Note that the very first frame of VISA on the right is identical to the original diagnostic plane on the left, which is the three vessels and trachea view. During VISA, the image changes automatically until the three vessel view is shown. This artistic representation demonstrates the VISA movements just seen, in which the three vessels and trachea view is automatically being changed into the three vessel view. Here is another example. When performing fetal echocardiography, it is essential that the pulmonary veins are identified as well as the atrial septum. In the left video clip of the four-chamber view, the pulmonary veins are seen entering the left atrium. In the right video clip, the entire atrial septum is depicted, both the septum primum and septum secundum. One particular advantage of the four-chamber view VISA is that it automatically allows visualization of the pulmonary veins. The four-chamber view VISA also shows the atrial septum, both the septum primum and septum secundum. Note that the diagnostic plane on the left shows the septum primum, but the septum secundum is not seen adequately. And yet, VISA demonstrates this successfully as shown by the red arrow. Here is the same case showing the VISA video clip of the four-chamber view. As the video plays, note that first the pulmonary veins are shown nicely, as shown here. And then both the atrial septum primum and secundum are also shown. This is best seen in this frame and these frames. There is empirical data supporting the benefit of VISA in demonstrating the atrial septum. In this study, both the septum primum and septum secundum were seen in 46% of cases of the four-chamber view diagnostic plane, but were successfully seen in 94% when VISA was employed. For the remaining 6%, it is noteworthy that the five-chamber view diagnostic plane was able to demonstrate the atrial septum. Similarly, there is empirical data supporting the benefit of VISA in showing the pulmonary veins. In the same study, the pulmonary veins were seen in 44% of cases of the four-chamber view diagnostic plane, but were successfully seen in 96% when VISA was employed. Importantly, for the remaining 4%, the five-chamber view VISA was able to show the pulmonary veins successfully. Here is the last example. Both the aortic arch and ductus arteriosus should be assessed routinely on fetal cardiac examination, yet they are quite close together, and distinguishing one from the other on real-time sonography requires operator skill, as well as subtle movements of the transducer, which can be challenging to accomplish. On the left side, the aortic arch diagnostic plane obtained by FINE is shown. Notice that VISA's movements are able to automatically depict the ductus arteriosus for the user. Therefore, in summary, VISA provides more information about each of the 9 cardiac diagnostic planes and its surrounding structures. So, it can be used, for example, to visualize the pulmonary veins. Be sure to watch the next video on VISA in this YouTube series, where we will teach what information is provided within each of the 9 VISA cardiac video clips. We refer to this as VISA callouts, which state the purpose or action of the VISA navigational movements. The third benefit of VISA is that it can reduce false positive diagnoses of the fetal heart. This means that VISA can change a suspected abnormal fetal cardiac view to one that is interpreted as normal. Normally, the fetal aortic arch appears like a candy cane, and the smallest diameter of the arch occurs at the isthmus area indicated by the red arrow. The isthmus is located between the origin of the left subclavian artery and the connection of the ductus arteriosus to the descending aorta. A common but challenging congenital heart defect to diagnose prenatally is coarctation of the aorta. In this condition, there is narrowing of the aortic arch, typically located at the isthmic area between the left subclavian artery and the entrance of the ductus arteriosus. However, detecting coarctation in fetal screening programs is associated with a high number of false positive diagnoses, and even when performed by experts, echocardiography is often unable to distinguish false from true positive cases. So here is a case analyzed by FINE in which it is unclear if there is a coarctation of the aorta or not, because the aortic arch view shows narrowing in the transverse aortic arch and isthmus. Yet the four-chamber view appears normal, with no discrepancy in the ventricle sizes. In addition, there is no discrepancy in the size of the great vessels, as seen in the 3 vessels and trachea view and short axis view of the great vessels. Therefore, to determine whether this fetus has a true coarctation of the aorta, we will implement VISA assistance. The original aortic arch diagnostic plane is on the left. For this case, we grab the scroll button and go through the VISA video clip. As seen in the right image, in 3 separate instances, the VISA navigation reveals that the aortic arch is actually normal. Therefore, this is a false positive diagnosis of coarctation. This artistic representation demonstrates the VISA movements just shown, in which the aortic arch view is being explored in a targeted and intelligent manner. Here is a second example. Normally, in the left ventricular outflow tract view, the aorta originates from the morphologic left ventricle. The anterior wall of the aorta should be in continuity with the ventricular septum, while the posterior wall of the aorta should be in continuity with the mitral valve. Moreover, the mitral valve should move freely, as seen in the video. For this case, the left ventricular outflow tract diagnostic plane should be examined more carefully. Why? The mitral valve doesn't move well, and there is not clear continuity of the anterior wall of the aorta with the ventricular septum. Therefore, a ventricular septal defect cannot be ruled out. However, by activating VISA, it is clear that at frame 311, the left ventricular outflow tract appears completely normal, and there is no ventricular septal defect present. The anterior wall of the aorta is continuous with the ventricular septum. This is frame 311. At frame 317, the mitral valve excursion is also normal. Later, at frame 374, there is again confirmation that the left ventricular outflow tract appears normal. Thus, in summary, we have shown that VISA can reduce false positive diagnoses of the fetal heart. The fourth benefit of VISA assistance is that it can show the appropriate azimuth in the fetal heart. What is azimuth? An azimuth issue means that there is a tilted stick volume acquisition and plane. So how does one suspect that there could be an azimuth issue? When the atria and/or ventricles appear foreshortened in the four-chamber view. This is a normal four-chamber view. Notice that the two atria are equal in size, while the two ventricles are approximately equal in size. However, in these two different cases, the left side of the fetal heart appears smaller than the right. The question is whether there is congenital heart disease or instead just an azimuth issue because the four-chamber plane is tilted. When the five-chamber view diagnostic plane has this appearance, in which the left side of the fetal heart appears smaller than the right, one must determine if the heart is normal or not. VISA should be activated. Through automatic navigational movements, VISA shows that there is normal symmetry of the left and right sides of the heart. Therefore, this fetus does not have congenital heart disease, but rather just an azimuth issue. This is the same case, but showing the VISA video clip live. Notice that the left side of the heart is completely normal, and so this was an azimuth issue. Here is another example. In the five-chamber view diagnostic plane, the left ventricle appears smaller than the right. To determine whether this is due to just a tilted plane or azimuth, or because the left ventricle is truly hypoplastic, we activate VISA. The red arrow points to the left ventricle. At several time points within the VISA video clip, it is obvious that the left ventricle is not truly hypoplastic. This is shown here in these set of frames, and then later in the VISA video clip in the call-out that says left ventricle, it is obvious that the left ventricle is not hypoplastic. In summary, VISA can show the appropriate azimuth in the fetal heart. This is important since tilted planes may lead to suboptimal visualization of anatomy or raise suspicion of an abnormality. The fifth benefit of VISA assistance is that it can show the cardiac abnormality and therefore is especially informative and valuable in cases of congenital heart disease. Specifically, VISA does this in 3 ways. In cases of congenital heart disease, VISA delineates complex anatomical relationships. Second, it depicts cardiac abnormalities when the diagnostic plane appears normal. And third, VISA provides further diagnostic information even when the diagnostic plane is abnormal. We will now show examples for each of these. Normally, the fetal heart and stomach should both be on the left side, but if the 4-chamber view of the heart and the stomach are on opposite sides, the risk of congenital heart disease is more than 95%, and one should suspect heterotaxy, such as asplenia or polysplenia. Here, the stomach is on the right side, while the heart is on the left side. The normal azygous vein, shown by the black arrow, transports deoxygenated blood from the thorax and abdomen into the superior vena cava. It courses up the right side of the spine, draining into the superior vena cava and forms the azygous arch. Therefore, it is located next to the descending aorta. When there is an interrupted inferior vena cava with azygous vein continuity, there is an absent inferior vena cava, and venous blood drains through the azygous, which is then dilated and readily visible. The azygous vein drains into the superior vena cava. Because the azygous vein becomes enlarged and readily visible, one can see both the aorta and dilated azygous vein posterior to the heart near the spine in transverse views such as the 4-chamber view. This is known as the double vessel sign, appearing like a double-barrel shotgun. As we stated before, an important benefit of VISA is that it delineates complex anatomical relationships in cases of congenital heart disease. So, here is a fetus with asplenia and interrupted inferior vena cava with azygous vein continuation. First, note that in the abdomen, the stomach is abnormally located on the fetal right side. Moreover, the liver is midline and in the left upper quadrant of the abdomen. As VISA navigates into the 4-chamber view, notice the double vessel sign and that the cardiac apex is pointing to the left side of the chest. In the 3 vessels and trachea view, the vertical azygous vein is seen draining into the superior vena cava. Here is a second case. Normally, the great vessels cross as they arise from their respective ventricles. The right ventricle is connected to the pulmonary artery, while the left ventricle is connected to the aorta. However, in complete transposition of the great vessels, the vessels are parallel to each other and side by side as they arise from the ventricles. Now, the right ventricle is connected to the aorta, while the left ventricle is connected to the pulmonary artery. In the normal fetal heart, the pulmonary and systemic circulations function in series. deoxygenated blood comes from the body and reaches the lungs, where it becomes oxygenated and returns back to the body. However, in complete transposition of the great vessels, the pulmonary and systemic circulations function in parallel, resulting in cyanosis of the neonate after birth. This is because deoxygenated blood keeps circulating to the body, while oxygenated blood keeps circulating to the lungs. So here's an example of VISA, which depicts the cardiac abnormality even when the diagnostic plane appears normal. The 5-chamber view diagnostic plane is shown on the left side, and this appears normal. However, when VISA is activated, one can now see 2 parallel great vessels arising side by side from the ventricles, which is consistent with the diagnosis of complete transposition of the great vessels. VISA also provides further diagnostic information even when the diagnostic plane is abnormal. This is a case of hypoplastic left heart, double outlet right ventricle, and transposition of the great vessels. The abnormal diagnostic plane shows a single vessel arising from the right ventricle that bifurcates, consistent with the pulmonary artery as shown by the red arrow. However, a second vessel could not be identified. After VISA is activated, automatic navigational movements now demonstrate the aorta, which is rightward, anterior, and also exiting the right ventricle. Therefore, the 2 vessels are parallel and side by side, consistent with transposition. This is the same case showing the VISA video clip live. Automatic labeling from FIND shows a hypoplastic left ventricle in the diagnostic plane. VISA automatic navigational movements now demonstrate a second vessel, which is the aorta, that is rightward, anterior, and also exits the right ventricle. Therefore, the 2 vessels are parallel and side by side, consistent with transposition. The final diagnosis is hypoplastic left heart, double outlet right ventricle, and transposition of the great vessels. In summary, in cases of congenital heart defects, VISA is especially informative and valuable. The 6th benefit of VISA assistance is that it serves as an education and teaching tool. We have heard this feedback from users on many occasions. Here is a case of tetralogy of Fallot. The short axis view of the great vessels, right ventricular outflow tract diagnostic plane is shown on the left. It is clearly abnormal. Automatic labeling of the right ventricle and pulmonary artery is correct, but the pulmonary artery bifurcation is not seen well. By activating VISA, the narrow pulmonary artery, its bifurcation, and a tortuous ductus arteriosus are now clearly seen. Therefore, VISA serves as an educational and teaching tool by automatically showing the cardiac abnormality to the user. It is noteworthy that when scanning this particular fetus live using 2-dimensional sonography, we were not able to obtain the image on the right, but we could using VISA. In summary, VISA serves as an education and teaching tool for the user. The 7th benefit of VISA assistance is the existence of color VISA. This will also be discussed in the video on color Doppler find of this YouTube series. Please be sure to watch this video to learn in detail about color Doppler velocimetry of the fetal heart. Color Doppler flow mapping is a valuable and integral component of fetal cardiac examination. since it allows identification of cardiac structures and vasculature, as well as the pattern and direction of blood flow throughout the heart. Indeed, some investigators have recommended that color Doppler should be employed routinely, even in fetal cardiac screening. When color or power Doppler velocimetry is combined with the fine method, this is known as color Doppler fine. The technology has now been successfully integrated into several commercially available ultrasound systems worldwide and is also known as 5D Heart Color. Similarly to the original fine method, VISA may also be activated in color Doppler fine for any of the 9 cardiac diagnostic planes, and this is known as color VISA assistance. There are several benefits of color VISA assistance. First, by improving the success of obtaining a given cardiac view, an appropriate color Doppler signal becomes visible. Color VISA allows visualization of more anatomic structures, for example, the hepatic veins. And finally, color VISA reduces false positive diagnoses, for example, a pseudo-ventricular septal defect. We will now show 2 examples. The diagnostic plane of the short axis view of the great vessels does not show systolic perfusion through the ductus arteriosus. To solve this issue, color VISA should be activated. By doing so, the short axis view of the great vessels is now improved, and this is shown here. This image now replaces the original diagnostic plane, and an appropriate color Doppler signal is now seen through the ductus arteriosus. So in summary, by activating color VISA, there is improved success in obtaining the cardiac view with an appropriate color Doppler signal. This is a second example. The left ventricular outflow tract diagnostic plane shows a blue color signal from the right ventricle crossing over the anterior wall of the aorta and spilling into the aorta, giving a Y appearance. So the question is whether there is a ventricular septal defect or not. However, after color VISA was activated, automatic navigational movements improved the cardiac view, and it became clear that there was no ventricular septal defect present. It is noteworthy that no settings, such as color threshold and balance, were changed between these 2 images. In summary, color VISA assistance provides several important benefits to color Doppler imaging of the fetal heart. Please be sure to watch the video on color Doppler fine in this YouTube series to learn all about this novel technology. Taking everything together, overall, VISA assistance improves the quality of cardiac examination since the complexity of the fetal heart can be studied in greater detail and specific structures shown. In conclusion, there are 7 benefits of VISA assistance. It improves the success of obtaining fetal cardiac views when not initially obtained via the diagnostic plane. VISA provides more information about each of the 9 cardiac diagnostic planes and its surrounding structures. It can reduce false positive diagnoses of the fetal heart. VISA assistance can show the appropriate azimuth in the fetal heart and is especially informative and valuable in cases of congenital heart defects. VISA can serve as an education and teaching tool, and color VISA assistance provides several important benefits to color Doppler imaging of the fetal heart. Thank you for your attention.